687-373-9766. Well, we are broadcasting live. That's right, we're broadcasting live from Atlanta. We at the beautiful theater of the Association of Black Radiologists here in Atlanta to talk about the Grady Healthcare Crisis at a town hall meeting. Gentlemen, welcome to the One Hour Time Show. Dr. Edwards, let me start off with you. Healthcare is a major issue across this country. We see what's going on here in Atlanta with Grady. This is happening all over the country. In my hometown hospital that I was born in, actually, Cook County Hospital, had the same kind of situation going on. Luckily, somebody stepped in and actually saved that hospital. What do you think we're facing with today as far as healthcare? And what direction do we need to be going in? Not just here in Atlanta, but publicly. What direction do we want to get out here?
Well, I think that you have to look at it from a national perspective. You have county hospitals in every major city who are all suffering because there are more and more uninsured or underinsured patients who find themselves, without jobs. And as this economy continues to turn south, you will find that number ever increases. So right now we have approximately 47 million uninsured patients. And if you look at the real number, excluding those that may be considered here illegally, it's about 1 in 7 Americans who really find themselves without adequate health care.
Well, when I look at Atlanta, and I think about Atlanta, you have so many people who are very well off and affluent in this city, not just the state, the city. I mean, you have a lot of people who play professional ball, you have entertainers, you have entrepreneurs, you have literally, you may have more black millionaires in this city than anywhere else in America. Why isn't anybody calling these people out and stepping up to the plate? We're talking about health care for children, for senior citizens, a training grant for doctors. Why is it, one of the things that I advocate is this. I understand the government needs to help, but the government is not our dad. We have issues and problems that we know are our issues and problems, and nobody's coming to the forefront. I mean, God knows, Steve Harvey, I love him, he's my brother. I'm going to be at his event this Saturday. His event is sold out. We could spend enough money to go to his event. We can't take that same $5,500 and put it into the hospital system. Let's go out to the audience and see if we have any questions. Please give us your name and your question.
First and foremost, I am a true fighter down with movement and justice.
Yes, sir. I'm going to go get some shirts. I got some shirts in my car. I'm going to get some shirts.
My name is Abdullah Shaheed. I live here in the state of Georgia. My question is, since the state of Georgia has like 110 counties, why is it that Fulton and DeKalb are the only 2 counties bearing the blunt financial responsibility for carrying the rate? I mean, what are all these other counties contributing since they are benefiting from Grady Hospital?
The public hospital, and most folks going in who do not have the health care insurance, and they take all, whosoever will let it come, if you will. That's the unfortunate thing about it. We're expected for those hospitals to provide those services, but we're not expected to provide the shared financial responsibility. And that's why I said it goes back to the leadership of the state. If I were to govern this state today, that was one of the first issues I would have addressed, and that is coming up with a statewide funding where everybody can spend a small amount or pay a small amount, if you will, and that goes to that particular fund to keep a grade in some of the other more important hospitals open. But it's been that way for years, and I got to tell you one thing too, what's interesting. A lot of folks say in these other counties, well, our folks don't go there, but they do go there.